Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Plateau State records progress in vaccination exercise in spite of negative vaccine campaign. Africa CDC representative in Edo State says almost 50% of vaccinees are yet to report for second dose of COVID-19 vaccine. And South Africa to immunize 12 to 17-year-olds with single shot of the Pfizer COVID-19 vaccine. Nigeria recorded 6 additional fatalities from the coronavirus pandemic, with 226 new cases confirmed across 14 states of the Federation and the Federal Capital Territory. The Nigeria Center for Disease Control (NCDC) added that the fatality toll has increased to 2,767. In the meantime, as part of efforts to speed up the country's vaccination campaign, the federal government has made the COVID vaccine mandatory for civil servants effective December 1. Here's more on the virus update.
226 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 14 states and the FCT. It shows a drop by 25 cases from the figures reported earlier. The FCT had the most infections with 73 cases, Plateau had 34, Lagos followed with 25 cases and Gombe had 22. Abia State recorded 16 cases and Osun had 13. Other states including Kano, Rivers, Ekiti, Kaduna, Oyo, Delta, Edo, Jigawa and Nasarawa registered single digits. There were no cases reported from Bauchi, Ogun, Ondo and Sokoto states. The total number of confirmed cases has increased to 208,630. 203 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 196,326. Lagos still has the highest number of lab-confirmed cases, followed by the FCT and Rivers State. There were 6 additional deaths from COVID-19 complications reported in the last 24 hours, raising the fatality toll to 2,767. Currently, more than 3.1 million samples have been tested. Also, 5.2 million Nigerians have received a first dose of the COVID-19 vaccine, and over 2.4 million persons are fully vaccinated. In Africa, there are more than 8.4 million confirmed cases and over 215,000 deaths have been recorded across countries on the continent. The total global confirmed cases have surpassed 239 million, while deaths are beyond 4.8 million people.
And to Edo State, where residents are being asked to ensure that they complete the COVID-19 vaccination doses, as it is the only way to get proper immunity from the virus. This is coming from the African Center for Disease Control representative in the state, Dr. Pius Ononigwe, who observed that a significant number of people have not turned up for their second jab.
The second phase of vaccination in Edo State is in full swing. Residents are receiving both the Oxford AstraZeneca and Moderna vaccines. It has been noticed, however, that many have not come for the second jab. The Edo representative from the Africa Center for Disease Control says this could be counterproductive.
More than 50% or little close to 50% of the people who took their first dose are yet to come for the second dose. So it's only when we take the second dose that we have full protection.
The state has resorted to a strategy which seems to be bringing more people out to complete their immunization.
We have actually been engaging and also calling and sending texts, because we have the information for everybody that has taken the first dose that is also due for second dose. I think people are beginning to see the need for them to come out for second dose and they are coming out.
Mr. Barry Uwadiaye has just taken the vaccine and says he is quite comfortable.
All the fears people are having mostly is from ignorance. COVID vaccine is new, but vaccination is not new, and a lot of people have taken it, and I have just taken it, and I'm fine. And so there's no reason for anybody to be afraid of vaccination, because vaccination, as it is to stimulate your system to attack any inevitable infection or infestation.
Edo State is the 7th most affected state in the country, with over 6,500 confirmed cases of COVID-19 and 224 deaths. Experts say the surest way to be free from the effects of COVID-19 is to be fully vaccinated, and only fully vaccinated residents can confer herd immunity on the state.
And round 2 of the second phase immunization exercise for COVID-19 is ongoing in various centers across the 17 local government areas of Plateau State. According to health officials in the state's primary healthcare board, no fewer than 37,862 doses of the Moderna vaccines, as well as 35,204 doses of the AstraZeneca vaccines have been administered to residents in the state. State healthcare officials continue to appeal to residents to avail themselves of the vaccines, especially for those who have received the first jab to complete the full dose for efficacy, and also those who are yet to take part in the exercise.
The exercise is ongoing, except in some cases we have this issue of hesitancy. That has been our major challenge. You know, based on these conspiracy theories, some people will just bring you different kind of theories, making them not to accept the vaccination. But with the ongoing social mobilization, advocacy, people are convinced, so they are taking it now. We don't have much challenge per se. Yes, in anything, in any vaccination given, there must be some reaction. But most of the time, we discover that the reactions are mild. For us here on the Plateau, we have not recorded any serious event following this COVID-19 vaccination. So we have mild cases of the AFI, which can be addressed by the health workers at that level. So most of the time, we discover that yes, they may have mild pains at the area of, at the site of injection and other things. So for that, yes, there are what we call adverse event following immunization, but for us here, our own are mild cases, not serious one as such.
The National Youth Service starts with a 3-week orientation in camps located across all 36 Nigerian states and the FCT. Following this, corps members are deployed to both public and private sector organizations to work for another 11 months. Now, when COVID-19 broke out, the exercise could not take place due to restrictions on movement, fear of the health risks to corps members. But since the first year of the pandemic, NYC camps have reopened safely, and with the next batch going in later this month. Joining us to talk more about the safety in the camps is the One Health Division at the NCDC. She's Dr. Oyelaju Nkurumade. She also leads the NYC NCDC Safe Camp Reopening Project. She joins us virtually from Abuja. Thank you for joining us on the program.
Thank you for having me.
Doctor, how daunting was the task to reopen the NYC camps? And this is at the peak of the pandemic.
For us at NCDC, I would say that one of our vision actually is to ensure that we respond to outbreak of diseases across the state, irrespective of where is occurring. And our vision is to ensure that we protect the health of all Nigerians. And we should also remember that before we start reopening before we even had a lockdown, we started having cases of COVID-19 in Nigeria, and we've activated our response activities across the country to respond fully and actively to COVID-19 outbreak in Nigeria as far back as last year, February. And we've deployed all our rapid response team, deployed all our resources. We've activated all the necessary laboratory network to ensure that we rapidly detect the cases, and all the emergency operation centers across the state are fully mobilized to respond to this. And following lockdown, we started working with different sectors to ensure reopening of different businesses and sectors. We worked with aviation to reopen our aviation system across the country, and we developed guidelines for that, the same for schools, universities. So with NYC, it wasn't a daunting task. It was like part of our usual process of working with different agencies to ensure that we put up measures in place to ensure the safe reopening of their orientation camp. And this was actually easy for us as well, with the full commitment of NYC top management. We were able to align our visions as well as their protocols with their own strategies to ensure that the core members are safe while in camp, and also to continue to build the trust of the public as much as the parents of these core members in the NYC process.
Camps. Now, with another batch expecting postings, batch C, I believe, stream 1, prospective NYC, where does taking responsibility start from? And this is if there is a positive case, for example, in camp.
With the expectation of batch C going to camp from next week now, we'll continue to leverage on the same protocol and the same guidelines that we've instituted. And we keep working with the existing COVID-19 national response structure that have been put in place. This is to ensure that we leverage as much as possible on the surveillance structure at the state level where these camps are hosted, to ensure that we use this avenue to establish the surveillance system across camps, which involves compulsory COVID-19 screening tests for all prospective core members on arrival, and before registration, as well as all the camp officials. Only those that are negative are allowed in camp. This is to ensure that we reduce transmission as much as possible in camp. We've also worked with the NYC management to reduce the number of core members that are being mobilized per time as against what we used to have in the past. This is to ensure that it's easy for observance of physical distancing in camp to as much as possible reduce transmission. We all know that this virus take advantage of people gathering to thrive. So it to be easy for us to ensure that it's easy to practice physical distancing of 2 meters. We've drastically reduced the number of intake, and we batch their resumption daily to ensure that they don't cluster together at the entrance while conducting the COVID-19 test. And we have surveillance staff across the state surveillance staff across all the camps, working with the NYC officials to ensure that this screening is done, as well as if anyone is positive, they will activate the surveillance system for the COVID-19 structure at the state level. Such an individual is immediately taken into state isolation facilities, where it will be monitored and managed according to COVID-19 protocol, national COVID-19 protocol. And also the same activation of the surveillance structure ensure that you conduct contact tracing of all the people that are in contact with such an individual. At the same time, core members are mandated to come to camps with their face mask and hand sanitizer. Face masks are compulsory in camp for every activities, be it during parade, during lecture, and during lecture, to avoid clustering together, we also try as much as possible to make use of the e-learning tools. So some of these measures are the measures that have been put in place. And there are also strategic temperature screening center put within certain strategic locations in camp to ensure that they screen them and conduct active surveillance screening during camp activities. Thank you.
All right. Thank you so much, Dr. Koromade. But just before we let you go, maybe in 15 seconds, some students have asked a few questions. And one is, are gloves needed, allowed in camps, as important as masks or hand sanitizers?
The requirements are to come with face mask as much as possible and hand sanitizers. Gloves are not needed because in the process of wearing gloves, they can even transmit and continue to spread more infections after touching a lot of surfaces and touching people from hand to hand. So that can even leverage on infection transmission. So gloves are not part of the guidelines, and they've been. We had a webinar with them today where they've been told what are the requirements to come to camp with, which are strictly face mask and hand sanitizers, as well as the COVID-19 testing slip.
All right. We appreciate your time. Thank you so much, Deputy Director, Head of the One Health Division at the NCDC, Dr. Edo Koromade. Thank you so much for joining us at this time.
Thank you.
Still out on the program, South Africa approves vaccine for 12 to 17-year-olds. Please stay with us. Welcome back. South Africa has announced it will be reducing the age limit for COVID-19 vaccination in the country. From Wednesday next week, 12 to 17-year-olds will be allowed to get a single dose of the Pfizer vaccine only for now. Health Minister announced this. He gave details of the development during a virtual press conference this morning.
Today, I'm happy to announce that we have reached the stage where we are ready to open up vaccination for children between the ages of 12 and 17. This is the secondary school cohort. We are now ready to start vaccinations for this group, the young people. This service will start on the 20th of October to allow the necessary preparation on the EVDS registration system and also other logistical preparations. The Pfizer vaccine, which has been approved by SAPRA for this age group, will be used for the purpose of this vaccination of the young people 12 to 17. The Vaccine Ministerial Advisory Committee advised that for now we should only give one dose of Pfizer, while assessing information which suggests that in few cases all over the world there has been some short-lived cases of transient myocarditis after the second dose. At this stage, there's been no indication that the first dose has any serious side effects. So for now, it will be just one dose while the studies are continuing, which we believe that will still offer significant protection. And once more information comes, then we can space the second dose for the young people.
And Germany is seeing very high COVID incidence rates among children and adolescents. In some parts of the country, the Robert Koch Institute for Infectious Diseases reported the 7-day incidence rate among 10 to 19-year-olds is more than 500 per 100,000 people in the 8 areas. Now, Germany has also allowed COVID-19 vaccines to be administered to those aged 12 years and older. However, the vaccine rate for 12 to 17-year-olds, we understand, is still significantly less than among the adult population. This is also as the country has put a halt to free COVID testing, which has sparked an intense debate. For more on that, Deutsche Welle correspondent Daniel Winter joins us now from Berlin. Hello, Daniel. The German government has stopped handing out free COVID tests. Do Germans think this is a sensible move?
It's controversial, of course. On the one hand, those people who don't want to pay for tests may be encouraged to get vaccinated. On the other, people who really need to get tested may be more reluctant to. However, there will be some free tests for people who are in high-risk groups or in high-risk jobs, like working in hospitals, of course. In the end, the measure is seen as part of a carrot-and-stick approach from the German government in order to head closer towards a potential Freedom Day. However, at the moment, that day is looking a long way off.
The German authorities also say they don't know how many people have been vaccinated. How did this come about? And is it bad news for the country's recovery from the SARS-CoV-2 virus?
Well, Germany is administering booster jabs to those people who are in a sensitive age group, especially over 60s, but also people who are medically vulnerable to the coronavirus. It's also promoting a flu jab campaign. Now, that will also help to ease the burden on hospitals going into this winter period. Germans are beginning to wonder, though, with such high vaccination rates, when Freedom Day is coming. After all, the UK had its Freedom Day in the summer. But Britain is now in a difficult situation going into the winter. It has the highest number of COVID cases in Western Europe, and Germany doesn't want to enter into that particular situation. Going into a winter with a high number of COVID cases could end up putting a greater burden on hospitals here. So when it comes to Freedom Day, Germans are probably going to have to wait until next year.
Well, Daniel, I mean, looking at how Europe is preparing for winter and the rising cases, tell us what German authorities are seeing, and this is with regards to not knowing the amount of people being vaccinated in the country.
Well, the issue here was that not all vaccination centres kept the kinds of records that they were supposed to. And so the total that is actually registered in the official statistics could be 5% less than the actual number of people vaccinated. But in the end, that's good news. You know, 5% may not sound like a lot of an increase over the official stats, but that could account for 3 or 4 million more people vaccinated than previously thought. Now, in some areas of Germany, the rate of people who are fully vaccinated is as much as 75%, or even 94% of those who are over 60 years old and therefore at the highest risk. But the government has said not to get too confident, and that it doesn't mean that we're going to unlock everything very soon, because we have to brace the country for a potential fourth wave of infections during this winter. And once we know how the wintertime will affect the rate of infections, that's when we'll be able to say whether the vaccination rate will allow us to come out of lockdown and decrease or roll back some of the measures that are currently in place in Germany.
Deutsche Welle correspondent Daniel Winter live for us there from Berlin. Thank you. And the United States has announced that it will reopen its borders to fully vaccinated travelers from November 8. Under new rules announced by the White House, vaccinated people who have had a negative test in the 72 hours before traveling will be allowed to enter. The move marks the end of the tough restrictions that have been imposed on travelers since early last year. Here's more on the global COVID-19 update.
Russia has reported a record 999 coronavirus-related deaths in the last 24 hours, as well as 32,196 new infections, its highest single-day case tally since the start of the pandemic. The country's health ministry has called on doctors who are retired or are in self-isolation to get vaccinated and get back to work to help combat the pandemic. The Kremlin has blamed the rise in death toll on Russia's slow vaccination campaign. The Australian city of Sydney has announced plans to let in fully vaccinated travellers from overseas after more than 19 months. Up until now, thousands of Australians living abroad have been unable to return home because of a strict cap on arrivals. The plans are set to come into effect from next month.
So for double vaccinated people right around the world, Sydney, New South Wales is open for business. We want people back. We're leading the nation out of this pandemic. A hotel quarantine, home quarantine is a thing of the past. We are opening Sydney and New South Wales to the world.
4 months into one of its worst COVID-19 outbreaks, Israel is seeing a sharp drop in new infections and severe illness. Officials say this is aided by its use of vaccine boosters, vaccine passports and mask mandates.
What brought down Delta in Israel was a combination of several components. It was the masks mandate, the green passes vaccine certificate policy, the massive testing, both with rapid antigen tests and PCR testing. But undoubtedly the most important impactful factor in bringing down Delta was the mass vaccination campaign with booster doses that allowed us to reach a very high percentage of those previously vaccinated with 2 doses with a 3rd dose. And that really brought us to the point we are today, with finally once again a very rapidly declining trends in both morbidity and severe morbidity.
COVID-19 health passes are now compulsory for all workers in Italy, with the measure being applied across the country despite some scattered protests. The Italian government hopes the move would convince unvaccinated Italians to change their minds. Over 80% of residents over the age of 12 are already fully inoculated. And finally, the Philippines has started inoculating 12 to 17-year-olds with underlying conditions against COVID-19 as the country ramps up vaccination amid the spread of the Delta variant.
Continue to take responsibility. You can take a look at our website. It has the latest breaking stories. You can also find a better understanding of the pandemic. You have that top story there of South Africa. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Wonga. Stay healthy.